好了。Hello everyone. Today we will study renin angiotensin aldosterone system. So you have studied this system in several subjects. For example, we know angiotensin under renin converts into angiotensin 1. And then angiotensin 1 under which enzyme? Yeah, angiotensin converting enzyme, and then convert into angiotensin 2. Angiotensin 2 bound to its receptor, such as angiotensin 1 receptor, and have pathophysiological function, such as vasoconstriction, and promote aldosterone secretion, so blood pressure increase, and in the long term, remodeling hypertrophy. We also know angiotensin converting enzyme also affect bradykinin system and promote bradykinin degradation. And we know bradykinin is the strongest vasodilators in our body. So vasodilation and then blood pressure reduced. Today we will study first kind of drugs. We call them ACEI, angiotensin converting enzyme inhibitors. The prototypical agent is captopril. These drugs, angiotensin converting enzyme inhibitors, mainly inhibit angiotensin converting and then inhibit angiotensin 1 converts into angiotensin 2. So inhibit angiotensin 2's production and functions. Inhibit vasoconstriction means the vasodilation. That means later we can use ACI to treat hypertension. And in the long term, also inhibit and reverse hypertrophy and remodeling. Very useful for the patients. But here we also know angiotensin converting enzyme also affect the bradykinin system. So that means later we study ACEI, angiotensin converting enzyme inhibitors, also inhibit bradykinin degradation. Inhibit bradykinin degradation, what's the meaning? That means we'll increase bradykinin. Yeah, increase bradykinin. We have known bradykinin is the strongest vasodilator, but we also have known bradykinin is one of the allergic factors. So means we use ACI at the same time we'll have side effects such as cough, dry cough, allergic reaction. The main reason is here because it inhibits bradykinin degradation. Compared to ACEI, in clinic, we have one kind of drugs, we call them ARB, angiotensin converting enzyme inhibitor, we call them ACEI. ARB means the angiotensin 2 receptor blockers. In clinic, we use losartan, valsartan, ibralisartan. They are ARB. And these drugs in receptor level inhibit angiotensin 2's pathophysiological function. So from this picture, we know, compared to ACEI, ARB not only inhibit this mainly pathway, enzyme pathways angiotensin 2, but also inhibit other pathways, such as thymus bypass, angiotensin 2's production and function. So compared to ACEI, ARB more powerful than ACEI. And also from this picture, we know ARB, angiotensin receptor blockers, do not affect bradykinin degradation. So what's the meaning? Our patients use ACI nearly no dry cough, no allergic reaction. Okay? So in this part, and we will study angiotensin converting enzyme inhibitors, captopril's pharmacological effects. The first effects, these drugs can inhibit angiotensin 2's production and functions. we have known inhibit angiotensin converting enzyme, inhibit angiotensin II's production and functions. Angiotensin II promote vasoconstriction, promote aldosterone secretion. So we use ACEI can inhibit these pathophysiological functions. That means ACEI can reduce can reduce blood pressure and inhibit reabsorption. Except these effects, just now from the picture we have known, ACEI also inhibits bradykinin degradation. That means increase bradykinin concentration in the tissue, in the organ. So bradykinin will bind to its receptor and then promotes prostaglandins and nitric oxide increase. So it is the strongest vasodilators in our body. That means ACEI increase bradykinin means the vasodilation, blood pressure reduced. So later we can use ACEI to treatment of hypertension. Yes, you to treat hypertension. But just now we also know here, increase the allergic factors will have the adverse reaction such as dry cough. And the next pharmacological effects of ACEI can protect endothelial cell and anti-atherosclerosis action. That means, yes, ACEI can protect vessel cell, can use to treatment of atherosclerosis disease. And number 4, anti-myocardial ischemic reperfusion and myocardial preservation. So for this reason, that means as the most important ACEI as the most important basic urgent to treat heart failure and to treat myocardial infection. 你先咳一下，没事儿，我们可以把它 cut 掉。OK 。Okay, continue our class. The fourth pharmacological effects of ACEI inhibit myocardial ischemic reperfusion and myocardial preservation, means the ACEI have protective effects on heart. So later we can use ACEI to treatment of heart failure and myocardial infarction as the most important basic urgence. Number 5, ACEI, captopril, this kind of drugs also can increase insulin sensitivity. We have known insulin is the hormone can reduce blood glucose level. So increase insulin sensitivity, that means ACEI maybe can reduce glucose level. So ACEI for diabetic mellitus patients and hypertension patients very useful, especially for these patients should be used to treat diabetic nephropathy, diabetic mellitus with hypertension as the first choice urgence. Except these pharmacological effects, and ACEI very important because this kind of drugs long-term use in the long term can prevent and reverse cardiovascular system remodeling, inhibit partial reconstitution. What's the meaning? We treat a disease, we have 2 aims. The first aim, we want to treat a disease to control the symptoms. But we also have the second aim. In the long term, we want to protect the organ. We want to inhibit the complications. So from these effects, ACEI long-term use can prevent and reverse hypertrophy and remodeling. So that means ACEI can inhibit remodeling, inhibit complications, and very useful for the patients. And so we use ACEI to treat these diseases. The first one used to treat hypertension. ACEI treats hypertension as the first-line therapy for hypertension. To treat mild to moderate hypertension as the monotherapy, only one agent alone used to treat mild to moderate hypertension. And especially for these drugs should be used in patients, heart failure patients, diabetic mellitus patients, or renal disease patients with hypertension as the first choice. The reason just now we explained. For example, why for heart failure patients with hypertension as the first choice? Because just now we mentioned ACEI can inhibit ischemic reperfusion damage. So for heart failure patients with hypertension, your first choice antihypertensive drug is ACEI. And the second patients, diabetic mellitus patients with hypertension, we use captopril, enalapril as the first choice. Why? Yes, excellent. Because ACEI can increase insulin sensitivity. So that means not only reduce blood pressure, but also reduce glucose level. So very useful for diabetic mellitus patients with hypertension. The second using, we can use angiotensin converting enzyme inhibitors, captopril, enalapril, to treat congestive heart failure and myocardial infarction. The patients, if they can as early as possible, use ACEI as the basic agents to treat congestive heart failure, myocardial infarction, can hugely reduce mortality and morbidity, can improve patients' life behavior. So for these reasons, ACEI is the basic agent for heart, for vessel disease, especially for heart failure patients. The third using, we use ACEI to treat diabetic nephropathy and nephrosis. Why? Just now we mentioned ACEI can increase insulin sensitivity, so can reduce glucose level and also can protect renal function. In clinic, ACEI, captopril, enalapril is the only kind of agent for diabetic nephropathy. We studied ACEI's clinical using, so you should know the adverse reaction. The first adverse reaction, we use to treat hypertension, vasodilation, reduce blood pressure, but our patients, especially in the early stages, they will induce positive hypotension. And we call this the first phenomenon. Because just now we mentioned ACEI can increase bradykinin, yes, so the major adverse reaction is the dry cough. The reason for withdrawal. We introduced the best antihypertensive drug, especially diabetic mellitus patients with hypertension, ACEI, but 15 to 30% of patients, they withdraw the drug. The reason is that adverse reaction, because the patients use the drug dry cough. And dry cough, we have known allergic factors such as bradykinin, such as prostaglandins accumulation in the lung induce the allergic disease, dry cough. And other adverse action, for example, hyperkalemia. ACEI H is the inhibit renin angiotensin aldosterone system. Inhibit aldosterone, so potassium increase, induce hyperkalemia. The fourth adverse action is hypoglycemia. The reason is increase insulin sensitivity. So for some patients, induce hypoglycemia. Here, we should know the major adverse action is the dry cough. ACEI also damages renal function. Why? The reason is captopril-enalapril vasodilation, especially relax renal artery. Renal perfusion pressure reduced, so filtrability reduced, and maybe damage renal function. But maybe you're confused. Why? Just now we mentioned ACEI is the first choice agent for renal function decrease, renal disease with hypertension. Do you remember? Yes. But this adverse action, we call this reversible. Means that once we withdraw the drugs and the renal function can recover. So we still can use ACEI to treat renal disease with hypertension. Number 6, for induce factor factors such as underdevelopment, fetal death, and abnormality. So what's the meaning? Can we use ACEI to treat pregnancy hypertension? No, we couldn't use. But here I have a question. If you have a pregnancy hypertension, which kind of antihypertensive drugs you can use? CCB, yes, excellent. We can use calcium channel blockers to treat a pregnancy with hypertension. And other adverse action, for example, acute circumscribed edema. It is one of the allergic disease, and it is the vascular neuroedema. So mainly occurs in lips. It is one kind of allergic disease. The main reason because ACEI can increase bradykinin. Other adverse action, for example, skin rash, gastria, and smell disturbance. In this part, the prototypical agent is captopril, but this year in clinic, the most widely used ACEI is enalapril. So let's study enalapril, the special features. Compared to ACEI, compared to captopril, enalapril more powerful and longer action than ACEI than captopril 10 times. So for example, we use and the second figure, enalapril longer activity, higher sensitivity than captopril. The half-life more than 24 hours. So here, if our hypertension patients, they use captopril to treat hypertension, they should use the drug TID oral administration because short half-life. Compared to enalapril, we use captopril 3 times. And enalapril longer half-life than captopril, so our patients can use the drugs once daily, QD oral administration, because higher efficacy and longer half-lives. So in clinic, the most widely used ACEI is this one, enalapril, mainly used to treat hypertension as the first-line agent. For your most anti-hypertension patients as the first choice antihypertensive drugs, also used to treat heart failure, and as the most important basic agents. The adverse action compared to captopril, same adverse action is dry cough. Compared to captopril, milder than captopril. In this part, except ACEI, in clinic, this year we also use ARB, angiotensin 2 receptor blockers, such as losartan, valsartan, and irbesartan. These drugs, they are angiotensin 2 receptor blockers. For example, losartan. The drugs compared to ACEI can block angiotensin 2, the first subtype's receptor. And compared to ACEI, these kind of drugs do not cause bradykinin potentiation. So what's the meaning? Nearly no dry cough, no edema. And compared to ACEI, these drugs higher sensitivity and longer half-lives. So our patients, for example, hypertension patients, use losartan to treat hypertension. It's once daily because long half-lives. So mainly used to treat hypertension and also used to treat heart failure. The drugs compared to ACEI, so we know two sentences. The first one is more powerful than ACEI. And the second figure is nearly no dry cough, no idle section. But now I have a question. For diabetic mellitus hypertension patients, your first choice urgent is ARB or ACEI? ACEI, yes. Compared to ACEI, ARB couldn't increase insulin sensitivity. So we should know, for diabetic mellitus with hypertension patients, the first choice urgent still ACEI. In this part, renin angiotensin system, we studied two inhibitors. One kind is ACEI. The prototypical urgent is captopril. Just now we studied this kind of drugs for pharmacological effects, clinical using, and idle section. And just now we also mentioned the second inhibitor, ARB, angiotensin 2 receptors blocker. Two questions. The first one is pharmacological effects, clinical using, and idle section of ACEI. The second question is the difference of ARB with ACEI. Okay? Class finished.